Hello everybody, today we have an amazing topic. You have to remember when we talk about the importance of having a healthy tooth where the nerve is intact, it's a vascular system, we have a dentin and we have enamel surrounding. This is a healthy tooth, but what happens when you don't floss and brush? Bacteria start getting into your teeth and start coming into the small ways until they become in a huge way to you. And what happens, it gets into the nerve, and after the nerve, what is the following steps? Now you need a root canal. What are the ideal steps that you're gonna have a successful treatment? That's what we're gonna talk today about it. The easiest, take care of your treatment, correct? And now we are gonna say, if we have an easy way to do a root canal, what do we mean with that? What do the endodontists do when they do a root canal? This is our coronal part. They have to open a space in here, and after that space, they go inside the nerve, and they're gonna measure the nerve, and after the measurement of the nerve, then they're gonna wash until the mid-root, the apical area. All of this has to be cleaned correctly, and it has to be done in a way that you are gonna be having a successful treatment. So, do you think this is an easier treatment? We're gonna talk about this case in more depth later. But imagine this is a root canal of a patient that had a root canal already and failed. We're gonna talk later about that. And to have a successful treatment, your dentist has to do a good diagnosis and treatment plan. How are you gonna use that tooth? And we're gonna talk about all of this later, that you have a good medical history and you want to avoid to have. This is the coronal part. Look at this. When you see this in an x-ray, it's because they put a crown on you. This is a tooth that doesn't have any crown, but it has some caries. Look how dark looks here. That caries is getting close to the nerve, and this is the nerve. So, but when this gets to the point that you see a round, very dark area, it's an infection. But the most fascinating part is the patient got to my office with all the pain in this inflammatory area. And if this patient, we're gonna talk about this topic also later, having come to me, he would have died of a septic shock because inflammation goes to your mouth and goes to your spaces of your brain, and you can end up with a septic shock. We have a lot of technology that we're gonna talk later, but what is the first thing they do? We can use in this canal, in these canals that you see, imagine, it's not only a root canal. What the endodontists do is enter into the system, and we have to wash an instrument with different instruments that we have a very good technology now, and choose a variety of size of instruments, and we have to measure the coronal part from here all the way down. And let's say the root measures 19, 21 millimeters. Then, okay, we follow that measurement. But we have to be sure your endodontist is gonna give you the time to be careful to avoid a fracture of an instrument, a fracture of the root. And for that, the endodontist, whether it's a she or him, is gonna go very slow measuring. We used to have on the past instruments that we use with our hand, but now we have a machine that we can use rotary instruments, and these instruments have make our life better and easier as endodontists. But it's important your endodontists have a magnification. This is important nowadays. I remember when I studied, we were not using this, not only in Mexico and the world. And in '92 that I was at USC, that's when the technology started coming with all this, which is different. With that, we can work with a microscope too and start cleaning the treatment. The first step is they're gonna open on the coronal part. As I said, we open a space here and we get into the instrument and we start washing the instruments. We have an amazing technology now. I'm gonna talk to you at the end about why it's very important These are very old instruments, rotatory instruments that we're using on the past. Now we have so many different ones that you don't know what to choose. But the important part is your endodontist knows that we're gonna open the space with a bigger instrument, then a smaller, and you have to listen this, irrigation, irrigation, irrigation. When we find that the instrument is deformed, we change it. Usually in my practice, I use the instruments one time and we trash them. But your endodontist, I'm sure, they have a variety of these instruments. We have another one's called Wave and the vortex value, Wave 1. It doesn't matter what technique that endodontist is gonna use. What is important for you is that your endodontist is using a rubber dam, isolating you from the saliva, and none of these instruments will go inside your mouth. And also, we have instruments that will make easier for us to find canals that are calcified. When the canals are calcified, we have to use these type of instruments that are rotary, where they look for these type of canals. The point in a root canal treatment is this: find all the canals. Once they find the canals, we use these instruments to help to find if we have very tiny canals, but also we have an ultrasonic that helps us to go and be digging inside. This image that you see, it's an image of a tooth open, and that is the magnification that you can see on the camera. And when you are on the microscope, you use different instruments that are able to get into the canals and open the most calcified treatment. These are gifts from Dr. Buchanan lectures where he's removing the calcified canals. And the name of the instruments is not important. What is important is that the hands of your endodontist are really trained to remove every single one. This instrument is used during surgery, which is in case your root canal fail, is for another topic. But what I wanted to tell you today, if you want to have a successful treatment, the first step is that your endodontist is going to open this cavity, is going to go inside, is going to clean, and is going to wash. Because if we don't have an extremely amount of irrigation during our root canal treatment, and the patient said, oh, it's finishing quick because you know what happened, this is finishing very fast because it's not going to be a problem in the endodontics world. However, irrigation is important. Your dentist needs to be aware, if he's doing the root canal, that the most important part in root canal is isolation, then measurement of the canal from the coronal part as I show you, then irrigation. We have so many ways to wash. We have here a handpiece, it's called endoactivator, and I'm gonna show you at the NM machine that I use nowadays. Some of my patients want to be sedated, so we use different type of sedation. Either I sedate the patient or the patient is sedated with anesthesiologist. But if you look at this, what we teach in endodontics for root canal treatments, what we learn is instrumentation. After you open an access, you have to clean very well the canal. You have to hear your endodontist is doing irrigation from the very beginning. There's no machine in the world that will avoid endodontists to go faster without irrigation. They need to have the time to irrigate, and then the obturation is when they place a material, actually it's coming from a tree, it's called garapercha, and you have to see in the x-ray this image with a really white color covering all your canals, because it has to cover every space. So if you look at this image, it's the amount of bacteria. Believe it or not, the most dirtiest bacteria of our body are in the mouth. So when you talk about, oh, it's only a root canal, no. Clean, brush, floss your teeth, so you will avoid to have these infections. That these infections, we will have a topic when they go to your spaces of the brain. You can have a heart attack, You can have also a septic shock and die. And we have so many different solutions that we use nowadays, so there's no excuse for us, and this is being used forever. I learned this in the 70s, and until today, this has been from the 40s. They use, believe it, we use Clorox, we use detergents, and all of these are mixed sometimes with antibiotic, which is the case of EDTA, has chlorhexidine, and this is the last part I wanted you to know. We use bleach, you're gonna have that smell, you are cleaning, there's no one irrigation, they have to use several ways to irrigate. Then after the end, your root canal has to be filled with a material that is called gutta percha, and that gutta percha is gonna be the last part of the root canal. These instruments that you see here are rotary. We used to use our hands all the time with the hand instruments. Nowadays it's extremely easier for us. However, don't get wrong. If they tell you you have a calcified canal and it's really difficult to have a root canal because it's calcified, or they want to extract the tooth, look for another endodontist, look for another opinion. Don't let anyone take your tooth out right away just because you are having a calcified canal. We have many ways to do it. And the last part, I tell you, this is a machine that we use to measure the canals. We have Morita, we have the company is not important. I always say when I lecture, the most important part is the cleaning. Look at how clean is the canal in the camera now. And I can show you a short video to show you how much we clean the canal, but we don't need to know. You're gonna see on the microscope. If your doctor have a microscope, at least you can have a magnification and they can see the canals extremely well. And at the end, what matters is that you don't have pain on your tooth. They open the access, they measure, they clean everything, and after the cleaning, they're gonna put the gutta percha, and this is the way when you look at the x-rays, look at the root here as a patient, because you don't know what they're doing. But I tell you right now, look at the limit of every root has a line black, and you follow that line, that's how it has to be full, completely all the way down. And this space is another topic that we're gonna talk later, how to take care of the sealant. This is temporary. Your endodontist has to clean well this area and place a good material. We have a topic of another in another lecture. But in this one, I tell you, the latest of the technology now is very interesting. I have a machine in my office, it's called Gentle Wave, and I'm sure some of the endodontists or dentists in our countries have it. And what it does, I don't agree that they said this is instead of irrigation, your canals with your hand or endo activator. This machine at the end cleans everything, whatever you were missing on the cleaning. And what the machine does is amazing, because you place the machine on the mouth, on the tooth, and start cleaning directly the way you see on the video right here. Start cleaning directly, and the end of the canal, after the machine is finished of the cleaning, then we can say, okay, my root canal is clean completely, ready to obturate, put inside the materials and temporize it and get ready for the next step that we're gonna have to talk in another program. But for today, remember, your endodontist has to have an isolation with a rubber dam, like you see on the camera here. It cannot be without this rubber, you cannot have a root canal. And then they open, they clean, and that's when you are ready to understand that you have a root canal that is gonna be very successful. If you have any questions, don't forget to subscribe to my channel, Dr. Fanny Yakaman. Follow us on Instagram and TikTok, and we will be happy to answer all the questions and comments that you may have on the program. Thank you.